All right, so we are right at about 24 hours post-surgery. You seen the video we just done this morning about 5:30. He was outside. All right, now it's about 9:30, 10-ish. So about 24 hours. Where are we at, Chris?
Ready to be done.
Ready to be done. Okay.
I'm thinking 6 months now.
Do you think? Yeah, okay, you're ready. All right, how's the pain?
It is not as bad as it was at 5:30.
So it is better.
It's better.
It's better. So what we're doing is he's taking his oxycodone every 4 hours. I called the pharmacist. He can rotate Advil, ibuprofen, 800 milligrams.
I can just take it. I don't have to rotate it. I can take it at the same time if I wanted to.
Right. But he can rotate that in every 8 hours, 800 milligrams, or he can take it alongside right at the same time with oxycodone. But here's why we chose to do it rotated in, is because something's always in your system and it's not wearing off. So we've made a schedule of when he's supposed to take what, set our timers.
For those of you who are thinking about doing this, let me tell you what happened yesterday, just so you'll know. The worst part of the day, even though it was a sweet little girl, was getting IVs in. Needles don't bother me, so it really wasn't all that bad. But this, for some reason, I forget that she called this armpit, that place something. I can't think of what it's called. It's just easy, or it doesn't hurt. But this one, every time, when I had cancer surgery, I had one on each hand.
Yeah.
So right there's the first try, and right there's the second try, and that's just, it just hurts. So anyway, but that was fine.
That's a side note.
That's a side note. They do a nerve block. We've already talked about the nerve block, so don't be scared of that. I was, because I had never had one done before.
We're going to do a little separate video on nerve block. We'll do that in a minute. So you don't have to go in depth about nerve block here, but we'll talk about it in a minute.
We'll talk about that in a minute.
Okay.
That's it.
Okay. Okay. Why do you have your strap undone? Is it you get tired of pulling on your neck?
Yeah.
Okay.
And this, I can rest instead of, this holds it up, but this armrest does exactly the same height. So.
Okay, so, but your feeling is all back in your hands. Have we already been over this? Your feeling's all back in your hands. It's normal.
That was a blessing.
Okay.
The only bad thing, I've been looking it up, it's called post-operative. Well, I don't forget what it's called. It's on my phone.
Okay, anyway.
Anyway, it's where you feel like you've worked out more than you have ever before.
Yeah.
The day after surgery, so I'm dealing with that. It's like my calves, my quads, my abs.
All your muscles are just sore.
My neck, it hurts like if I was eating a biscuit. If you try to now you swipe your tongue around, try to get things out from. It hurts to do that. It hurts to swallow, to an extent. But I'm pretty sure that's but these are all side effects of anesthesia.
Okay.
Common side effects.
But right now your pain level is tolerable. When you woke up this morning about 3:30, it was it was
worse.
Not severe, but you said very.
Have you ever been to a point where you just can't find a spot where it will go away?
Right.
It was like that.
That's what happened. But now we're manageable.
Yeah, it's just little twinges of things every now and then.
Okay. All right. Well, we'll be back.
For nerve block.
For nerve block.